Yes, there we go. And next slide. And then let's see. So welcome to the Public Health Work Group meeting. We will pass it over to Robin for our introduction right now.
Great. Thank you, Kevin. Good afternoon, everyone. Welcome to today's meeting of the Public Health Work Group of the California Climate Action Team. Thank you for taking the time to join us. My name is Robin Pierce, and I'm with the California Department of Public Health, Climate Change and Health Equity Branch. I'm joining from the ancestral and unceded land of the Chochenyo-speaking Ohlone people, also known as Oakland, California. Before we start, I want to provide some instructions for turning on simultaneous interpretation for all attendees. To turn on the interpretation, find the globe icon at the bottom of the Zoom screen and select your preferred language. The mute original audio option will turn off the other voices for a clearer sound. This applies to those listening in English as well. If you hear more than one voice, please click the globe icon and then click English and then mute the original audio. If you don't see the globe icon on the bottom of your screen, your Zoom software may need updating in order to take advantage of the interpretation function. Now I will give these instructions in Spanish. Bienvenidos y buenas tardes. Gracias por acompañarnos a la reunión de hoy del Grupo de Trabajo de Salud Pública de Acción Climática de California. Mi nombre es Robin Pierce y trabajo en la rama de Equidad en Salud y Cambio Climático del Departamento de Salud Pública de California. Antes de comenzar, quiero compartir instrucciones para activar la interpretación para todos los asistentes. Para activar la interpretación simultánea, busque el símbolo del globo o el mundo en la parte de abajo de la pantalla Zoom y seleccione su idioma preferido. La opción Silenciar audio original desactivará las otras voces. Si escuchan más de una voz, seleccione el símbolo del globo, luego haga clic en español y luego silenciar el audio original. Tenga en cuenta, si no ve el símbolo del globo en la parte de abajo, es posible que su sistema de Zoom necesite ser actualizado para así poder aprovechar las funciones de interpretación. Ahora le paso la palabra a mi colega Kevin Barajas. Now I'll pass the microphone to my colleague Kevin Barajas.
Next slide. Thank you, Robin, for those instructions, and welcome again, everyone. My name is Kevin Barajas. I use he, him pronouns, and I'm joining from Gabrielino Tongva Nation land. I serve as a health program specialist for the CDPH Climate Change and Health Equity branch. I will be joined today by my colleague Dan Wu, team lead of our branch, as well as other supporting members of our team. At CDPH, we work to assure that California's actions to prevent and prepare for climate change improve health, equity, and resilience. Our mission is to build health equity, improve living conditions, and advance climate action through policies, systems, and environmental changes. The Climate Action Team Public Health Work Group meetings are usually hosted by CDPH in partnership with the California Air Resources Board, or CARB, and provide a forum for public health partners and other stakeholders to learn about timely issues at the intersection of climate change and health equity. Today's presentations will focus on what California state agencies are doing to prevent and reduce the health impacts of extreme heat, protect those most vulnerable, and increase community resilience. With summer quickly approaching, we hope this meeting is timely and useful. Before getting started, we do have a few more housekeeping items. Next slide. Real-time captions are being provided today. You can find the closed caption feature along the bottom of your screen. Look for the CC icon. We'd like to remind presenters to speak clearly and at a measured pace for our captioner and interpreters. We've muted all attendees, but we encourage you to submit any questions you have through the chat or the Q&A features, which you can find along the bottom Zoom control bar. To view the speaker videos, click the view icon on the upper right and click standard or side-by-side speaker view for optimum viewing. If you have any concerns or technical difficulties, please send a private chat to my colleagues Dan Wu, Abigail Kennedy, or Renee Zapata. Next slide. This meeting is being recorded and it should be posted online about a week after this meeting at the following link. And we'll provide this link in the chat as well for all of you. Next slide. And now I'd like to introduce Dr. Rohan Radhakrishna, who will provide introductory comments and a land acknowledgement. Dr. Radhakrishna leads the CDPH Office of Health Equity, which houses the Climate Change and Health Equity branch. He also serves as the Chief Equity Officer and Tribal Liaison for CDPH. And now, take it away, Rohan.
Thank you so much, Kevin, and good afternoon to our 200 plus partners joining us today. My name is Rohan. I use he, him pronouns, and I stand for love, for dignity, and for transformation. It's my pleasure to welcome you to today's meeting. One of the roles I have at CDPH is to ensure that we work collaboratively across sectors towards racial and health equity, and that in every decision and deliberation, we apply a climate, health, and equity in all policies approach, or CHE. Today's meeting focuses on extreme heat, the #1 weather-related killer in the United States. Climate change is leading to more severe, more frequent, and longer extreme heat events. Last year was the warmest year ever recorded since global records began in the year 1850, with direct and many undocumented indirect impacts to human health. You'll see on Kevin and I's background that it's Mental Health Awareness Month, and the climate affects communicable disease, chronic disease, new climate conditions that worsen our communicable and chronic diseases, and affects mental health in many profound ways. Next week, it's going to be 104 degrees here in Sacramento, where I'm speaking to you from. And I recently listened to the audiobook with my children, The Heat Will Kill You First. That includes some anecdotes from California. Here in California, over the past 10 years, we saw an average of over 5,000 emergency department visits. And I remember, as a family physician in training, taking care of my first patient with extreme heat, where we had to fill a body bag with ice and give them cold IV fluids to rapidly lower their body temperature. 60 deaths on average due to heat-related illness, and we know this is a gross underestimate. You'll hear from one of our modelers and climate economists later today about our recent excess mortality analysis. And by the year 2050, heat waves in cities could cause 2 to 3 times more heat-related deaths, estimated to be more than 11,000 per year just in California. That's according to California's 4th climate change assessment. As you'll hear from our many speakers, the impacts do not harm equally. Populations like young children, older adults, pregnant people, those with existing conditions on medications, the unhoused, outdoor workers, and many others are disproportionately at risk and harmed. But California is not standing still. Today, our meeting will focus on what our state is doing to address extreme heat. And you'll hear from many agency partners on a team effort, from heat education and outreach efforts to new updated available heat guidance, worker protections, community-based strategies, and the development of a first-in-the-nation state heat ranking system. Now, of course, the success of our state government depends on how well we are listening to and working with our communities that are experts and directly impacted. And to help frame and provide context to today's meeting, we're grateful to hear from our opening speaker, Natalie Hernandez, to share her story about climate leadership at the community level. Our success also depends on how well we work with to address the needs of California's tribes. And I'd like to take a moment to provide a land acknowledgement. The extreme heat conditions addressed today would be much less severe if land theft, attempted genocide, and resource extraction perpetuated by Western colonizers had not occurred. These acts of violence towards indigenous peoples and the land they are connected to continue to impact all of us, and especially Native Americans to this day. The consequences of climate change, caused in part due to the actions of settlers, disproportionately impact Native Americans, who are also one of the most impacted populations to climate change as a result of state-sanctioned displacement to areas of the United States with less resources. That impact of structural racism has prevented Native Americans from benefiting from the same resource extraction and economic systems we live in. Today, we acknowledge that the state of California exists on the occupied lands of 109 federally recognized tribes, 62 non-federally recognized tribes recorded by the Native American Heritage Commission, and more that are considering or awaiting recognition, as well as their descendants. Many of these tribes are dedicated to reclaiming ancestral lands, protecting precious lifeways, and resisting the onslaughts of a rapidly changing climate. Tribal members and their descendants work together, heal together, and call for accountability from our state. Land acknowledgement is only one small part of supporting our tribal communities. The state of California is engaged in many efforts to be more accountable with and stand in solidarity with Native nations. A few I'll mention that relate to our topic of extreme heat today include our contracting with the Pala Band of Mission Indians to create a tribal heat starter kit as a template for tribal groups to adapt heat guidance. Support and funds for land-back grant programs through the California Natural Resources Agency, and utilizing nature-based solutions to combat extreme heat in partnership with California Native American tribes. We hope this land acknowledgement statement will inspire others to stand in solidarity with Native Americans, and that can look like donating money or time to tribes or indigenous-led organizations, returning land, or amplifying the voices of indigenous people leading grassroots change movements. 5 years ago, I joined my first climate action team public health work group when I was a local health officer. And I remember at the local level at Contra Costa County, responding to extreme heat events compounded with wildfire smoke and other conditions and power safety shutoffs. And now, 5 years later, it's been my joy to be part of this community at the state level to support our cross-agency partnerships and this team of climate change and health equity. I'll be departing this role at the end of the month and wish you all well, and know that California is and will continue to be a global leader in leading the fight for climate adaptation, mitigation, and resiliency. And I look forward to our session today to learning from our many partners on what we're actively pursuing together to make Californians safer and more resilient to extreme heat in our changing climate. So with that, I'll turn it back over to you, Kevin. Thank you.
Thank you, Rohan, for those incredible words. Next slide, please. All right. And now I'd like to welcome our opening speaker, Natalie Hernandez. Natalie serves as the Environmental Project Manager at the Gateway Cities Council of Governments. She was previously a director at Climate Resolve, where she managed the Ready for Tomorrow grant writing and research, co-authored the state's adaptation planning guide, provided technical expertise on climate grant programs, and led the community outreach for urban cooling and climate vulnerability projects across LA County. And now, take it away, Natalie.
Thank you, Kevin. So nice to see familiar faces in the Zoom room, and I appreciate the emoji reactions that I'm seeing pop up on my screen. I am calling in from the Gateway Cities Council of Government. The LA River, is behind me here. And I'm providing complimentary opening remarks to Rohan's statements about what extreme heat and health equity mean to me personally, and a little bit about my experience addressing the issues. Can you actually go to the next slide? There you go. To the right of your screen is a picture of my husband, Leonardo, who's an outdoor worker. He works as a trash refuse operator and was featured in the Los Angeles Times in September 2022 during one of Southern California's hottest, longest heat wave of 10 days. At the time, temperatures rose to 109 degrees in Long Beach that week, and his story was written in an article alongside other outdoor professionals such as construction workers and delivery drivers. So extreme heat is extremely personal to me, since I have a lot of family members who are exposed to the outdoor weather for their profession, and on a hot day, they risk their health for their jobs. There are, of course, safety precautions that they can take, like making sure their trucks have adequate air conditioning and taking ample breaks to cool off and stay hydrated. But it is inevitable that extreme heat, will have more days as they grow older and as we all grow older. So I think we all have some story or someone that we think about when we're talking about extreme heat. And I ask you to think about that person or that story today as we hear from the other speakers. Next slide. So up until a month ago, I was working at an amazing organization called Climate Resolve. They are a Los Angeles-based nonprofit leading the way on addressing extreme heat. During my time there, I engaged the community and stakeholders to bring about cooling infrastructure. I was, alongside my colleagues, advocating for cool pavement, cool roofs, and bus shelters. And I also wrote grants to try to get more shade structures and hydration stations in parks, as well as zero-emission air-conditioned buses and shuttles in disadvantaged communities. So there's some pictures up on the screen of that. We also educated residents about Camping 101 and emergency preparedness as it relates to extreme heat and climate disasters. And we invited community members to do fun activities with us, like plant trees. Next slide. Oops, it seems like there's some words that got misplaced, but currently I work as the environmental project manager at the Gateway Cities Council of Government, which collaborates with 27 cities in Southeast Los Angeles County and represents 2.1 million people. About 3/4 of our residents are in census tracts that have been classified by CAT-PHWG as disadvantaged. And in the coming decades, the LA County-wide daily maximum average temperature will rise by 5.4 degrees Fahrenheit. And the average number of heat waves is expected to increase tenfold by mid-century. So the map visualization displays the projected average number of extreme heat days for the gateway cities for the years 2035 to 2064. And the cities in dark red are projected to have an average of 100 or more extreme heat days a year of over 90 degrees. Furthermore, the LA County Climate Vulnerability Assessment conducted in 2021 notes a handful of vulnerable populations. Rohan actually mentioned a few of these too, but in our area, for example, the City of Industry, Santa Fe Springs, Vernon, and Long Beach, were determined to have the most climate exposed workers. There are also communities with proportionally high numbers of children, elderly, and those with pre-existing cardiovascular and respiratory illnesses who are sensitive to extreme heat. Moreover, those experience homelessness and low-income residents unable to afford air conditioning are also susceptible. Next slide. Okay, to finish my opening remarks, I want to tell you all about an exciting effort in the Gateway Cities. 5 partners, including the Council of Government, Saela Collaborative, Grid Alternatives, Tree People, and the LA County Chief Sustainability Office have come together to form the Gateway Cities Regional Climate Collaborative to uplift the voices and climate needs of 10 communities here on the screen in Southeast Los Angeles through engagement that invites residents, organizations, and elected leaders to participate in and lead the process. The establishment of the collaborative was supported through the Strategic Growth Council's Regional Climate Collaboratives Program, a capacity building grant that enables cross-sectoral partners to deepen relationships and strengthen local coordination, leadership, knowledge, skills, and access to critical resources to drive and sustain climate action. Together, we will build a well-defined social infrastructure for climate mitigation and adaptation projects. And our goal is to create and support community-led climate impact for a better future for all of our residents. So right there in the screen is a link to our LinkedIn. We just started a page and I invite you to follow us to keep track of our efforts. And I'll pass it over to Kevin and I'll be seeing you all later as I help facilitate the Q&A.
Thank you, Natalie, for those comments. Next slide, please. And now we will hear from Bonnie Holmes-Jen. Bonnie is the branch chief for the Health and Exposure Assessment Branch. within the California Air Resources Board's Research Division. Bonnie's work for CARB includes managing the board's health-related research agenda, overseeing health analysis of rules and regulations, managing work on air quality standards, and communicating important health information to the public. Take it away, Bonnie.
Hi, thank you. Assuming everyone can hear me all, or I'll see some sign of that. I'm really pleased to be here today. And while CARB is focused on achieving carbon neutrality in the next 2 decades and to reduce climate impacts, I know you're all familiar with that, we are also concerned about the many health challenges posed by extreme heat. 2 key areas that stand out, and let me just go to the next slide, sorry. 2 key areas that stand out in the next slide are the role of climate change in worsening air pollution and the many health challenges that combined stressors, including air pollution and heat stress, pose for communities in California. And we are currently, in fact, sponsoring research to analyze the combined health effects of stressors such as heat and pollution, wildfire smoke, and drought. And we're also inviting new research that I'll talk about in a moment to evaluate the benefits of heat adaptation strategies at the local level. Next slide. Extreme heat not only directly causes heat-related illnesses, but also worsens air quality, leading to increased premature deaths and illnesses and hospitalizations related to higher air pollution. And we have a wonderful document, our Scoping Plan Public Health Appendix G, and I'll put the link to that in the chat, where we discuss many of these health effects of extreme heat and the challenges that are faced for vulnerable communities. And I'll be talking more about that in a moment. Next slide. As with air pollution related health impacts, there's a long list of individuals and communities that are more vulnerable to heat health effects. And these were discussed by Director Rojas just a couple moments ago, but just noting that we share concerns about these vulnerable communities and individuals, and designing programs that can help reduce health impacts in these communities. Next slide. So in our 2022 Scoping Plan Public Health Appendix, we conducted a qualitative analysis on the impact of heat and its related and the health benefits of reducing heat. And many of the studies cited were conducted by our colleagues at OEHA and other agencies. We have an excellent literature review, and through our analysis, we found that reducing the heat impacts through our climate programs is associated with many co-benefits, from reduced mortality to reduced cardiovascular and respiratory illnesses, and reduced risk of adverse birth outcomes and mental and improvements in mental health. We focused on the importance of reducing heat impacts to improve health and to increase community resilience as we move forward. Next slide. So CARB is participating in statewide efforts to reduce heat impacts and to support heat adaptation strategies with health co-benefits. There are many programs pictured here, including CARB's California Climate Investments Program, that are very important, and we're looking at the benefits of some of these programs. Next slide. So we have some exciting new research. We're inviting solicitations. We're inviting researchers to apply to conduct this research, and we're calling it Collaborating with Communities to Find Ways to Cope with Heat and Reduce Health Impacts. A key goal is to help communities to find ways to cope with heat and in ways that will maximize a range of health benefits. And so we're looking at how to evaluate the local health benefits of heat adaptation strategies. And depending on the contractor chosen, the research may evaluate programs focused on urban greening or on cool roofs or other key strategies. And the key to us for this project is that we're asking investigators to work with community partners in developing and implementing this project and interpreting the results. Next slide. And an important aspect of the project is to ground truth the estimations of health benefits from heat reduction. And what we mean by ground truthing is that investigators will work with communities to gather information on their experiences. And we are looking for a team with existing relationships in the community. So here's some of the key results that we hope to achieve. We want to estimate both direct and indirect health benefits of implementation of local heat adaptation strategies. Direct benefits could be reductions in heat-related illness, and indirect benefits could be reductions, for example, in cardiovascular illnesses that, from reducing air pollution. And if possible, we hope it will be able to compare different types of heat adaptation strategies in different communities, and potentially, compare the benefits in different vulnerable communities. Overall, we hope the results of our research will help to assist state efforts to prioritize heat adaptation strategies as we continue to work on reducing greenhouse gases and addressing climate change. Next slide. I'm at 5 minutes. Okay, here's some key CARB contacts at our agency. We invite you to reach out to us. I hope this is a helpful overview, and I'll turn it back to Kevin for the next speaker. Thank you.
Thank you, Bonnie. So our next speaker, next slide, please. Our next speaker that we'll hear from is Maithili Ramachandran. Maithili is the climate and health economist with the CDPH, Climate Change and Health Equity Branch. Maithili specializes in the evaluation of public policies and in quantifying climate impacts on human health. Before joining CDPH, she worked as an associate specialist at the University of California, Riverside, conducting research on topics such as the effects of extreme heat on newborn health, the potential of sanctuary city policies to remedy mental health disparities, and the association between drinking water, manganese, and child cognitive health. Take away, Maithili.
Thank you. Could I go to the next slide, please, Robin? Good afternoon, everyone. My presentation today is about quantifying health damages from climate change for the state of California. My aim here is to provide you a very high-level statement of this problem and where I think economics has a unique contribution to make. Next slide. As I see it, the problem of quantifying health damages from climate change has 3 parts. The first part is how and which health damages to quantify. The second part is how these health damages are spread across the population of California, specifically knowing which groups are most vulnerable. The third part is a policy response to the health damages. So when we think about the first part, it's easy to see that there are many extreme weather events emanating from climate change, and there are also several different health endpoints affected by those events. So it makes sense to start with select pieces of the climate-health relationship. And for California, a good place to start is the extreme weather event that it encounters most, which is heat waves, and the outcome to which heat waves are most linked, which is excess mortality. Next slide, please. So the modified problem statement is 1, to quantify excess mortality from heat waves, 2, to determine how excess mortality varies across population groups, and 3, to argue for life-saving climate action. Very often, the case for climate action comes down to dollars on different sides of the argument. So it helps to start out quantifying climate health impacts, such as excess mortality, in monetary terms. Next slide, please. So let's dive into the excess mortality cost of heat waves. We could take the 2023 CDPH report on the last major heat wave to sweep California. That report found some 395 deaths could be attributed to the 10-day heat wave in September 2022. This is a past event, so its costs are realized for the most part, but suppose it were to recur with similar impact. Now, what could the state do to prevent such deaths, and how much should it spend? One way to answer this is with metrics like the value of a statistical life, also called VSL. So with VSL, we can establish the collective amount that society is willing to pay to prevent some mortality. And in 2019 dollars, the recommended VSL from the US EPA is close to $11 million. And a very rough and ready application of this figure to the 395 excess deaths from the previous heat wave suggests that Californians would accept state spending of some $4 billion to prevent heat-related deaths. Note this calculation is very approximate because it does not adjust VSL for several factors such as how it varies with income or the temperature mortality relationship varying across age groups and so on. Next slide, please. So while this is a good thought exercise, what matters more to policy is what heat waves and excess mortality will look like in the future. And here's where estimates from the Climate Impact Lab come in. Next slide, please. For example, this map shows mortality costs under a high emission scenario by the end of the century. California's mortality costs are projected at around 4% of national income by 2100. And we can see that California fares worse than a lot of other states, shaded blue in the map. However, what we are after is really what the excess mortality that is only attributable to heat waves look like, whereas this study tells us what mortality from all extreme temperature events are going to look like in the future. Next slide, please. So how do we learn about heat mortality in California's future? We could use climate models to project future heat waves. Then we use the dose response functions to project excess mortality. We translate that into economic terms, and then we compare the discounted benefits of avoiding excess mortality to the program costs of adaptation prevention. At the end of the day, we can support climate action by showing it yields net benefits to society. Next slide, please. So I want to end a little bit with what economics can best add. Economics is all about trade-offs. So I think the discipline should be harnessed to think about trade-offs in impacts, policy design, all of that. Something else I think that is missed in climate health studies, because it is difficult to model, is our own future behavior. I think economics can help imagine how human responses to climate change will evolve as we learn more about various trade-offs. Finally, economics can help us all evaluate among alternative climate adaptation strategies and do so with an eye towards health equity. And with that, I can pause and turn it back to Kevin and Dan. Thank you very much.
Thank you, Maithili. Next slide. Next, I will introduce two of my teammates from the Climate Change and Health Equity branch. First, we have Dan Wu. Dan serves as the team lead of the branch, leading cross-sector collaborative efforts to advance state climate policies, planning, and programs that promote health, equity, and climate resiliency. Joining Dan is Elizabeth Rhodes. Elizabeth is the branch Climate Change Local Assistance Manager, where she oversees the provision of climate and health equity technical assistance to local health jurisdictions and tribes. She also manages CDPH's work under the CDC's Building Resilience Against Climate Effects grant. I'll now pass it over to Dan.
Yeah, thank you, Kevin. Really appreciate everyone who's spoken so far. So today I want to highlight some of CDPH's efforts to protect communities from extreme heat, specifically in developing statewide heat guidance resources. So next slide, please. So this first document is the CDPH Extreme Heat Guidance for local health jurisdictions and community service providers. It was originally released in 2022 and was recently updated with some minor additions and new resources. But in short, this guidance combines heat guidance information, resources, tools, local case examples, and more into a comprehensive web resource. The focus is on protecting populations at greater heat vulnerability, including those shown. The central tool for guiding actions in this is the National Weather Service's Heat Risk Forecast, which provides a 7-day forecast of the potential level of risk for heat-related impacts occur over each day. The heat risk is illustrated by a color and a number ranging from 0 to 4, along with identifying the groups potentially most at risk at that level and what heat protective actions you can take. This guidance also presents heat scenarios to help think through planning and response. For example, laying out recommended actions in the scenario where someone doesn't have air conditioning at home, or if someone lacks access to consistent housing, or if someone is taking medications that might interfere with their ability to properly regulate body temperature. Recommendations for community scale actions are also included, including strategies like planting trees, increasing cool pavements, walls, and roofs, increasing shade, or measures like weatherizing homes, installing window films, blackout curtains, and more. A key takeaway here is that much can be done to prevent heat-related illness and deaths in the near, medium, and long term, as well as at the individual household and community scales. Next slide. So similar to the heat guidance for local health jurisdictions, this guidance references the National Weather Service's heat risk forecast and is designed for guiding schools. Again, the heat risk levels here shown in colors and numeric levels really helps to guide when schools should consider canceling or rescheduling outdoor school sports events or other activities. Again, this guidance document does not override any existing local plans or school district heat emergency plans and so forth. So those should be used first, but this provides a general comprehensive resource to supplement any jurisdictions that needs it. So you can see the levels of heat risk ranging from 0 or green to which represents little to no risk, all the way to level 4 or magenta with extreme risk. I'll note that the Centers for Disease Control and Prevention, the CDC, just released their heat risk dashboard, which is a more user-friendly and mobile device-friendly version of this forecast, which I highly recommend using for people to stay informed and plan ahead of hot temperatures. This guidance also includes detailed information on how to help student athletes acclimate to hotter weather, information on hydration, considerations for on-site heat monitoring, and more. And both of these resources are available on our website. I'll drop the links to the chat soon, and I'll turn it over to Elizabeth next.
Great, thanks, Dan. So next slide. I'll just be talking briefly about CDPH's interim guide to health equity-centered local heat planning, which was released online last year. And the purpose of this guide is to help local jurisdictions with incorporating health equity into new or existing heat action and planning efforts. And we want to note that using this guide is not mandatory, but it is intended as a resource that jurisdictions can use to protect everyone in your jurisdiction, but particularly those most at risk from the health impacts of heat. Strategies or elements from this document can comprise a new or updated standalone heat plan, or you could incorporate these strategies into public health emergency preparedness plans or other local planning efforts. Next slide. We heard from a number of entities that they wanted guidance around extreme heat planning. So we developed this interim guide based on a review of more than 40 local and regional extreme heat plans and guides for creating heat plans and other best practices for developing plans that center health equity. We also solicited feedback on a draft version of this guide from CDPH programs, from other state agencies, from local jurisdictions, as well as subject matter experts. And we have considered the version that was released online last year and which you can view now as a public comment version. We recently hosted a listening session to solicit feedback on this guide, and we look forward to ongoing feedback as you put this guide into use, and we are updating it for re-release for this year's heat season. And I'll just provide a very brief overview of what the guide contains. There are first steps. The steps outline each stage of a process for developing or updating a health equity-centered local heat plan, starting with engaging with the priority populations and partner organizations in your jurisdiction, identifying the heat risks to priority populations, setting thresholds for determining an extreme heat event, selecting your plan's actions, finalizing the plan, and finally evaluating its success. Next slide. Next slide. The plan also breaks down actions into phases of implementation. So there are long-term planning and mitigation actions, which include actions like urban heat island reduction. There are actions to implement before, during, and after your jurisdiction's heat season, and actions to implement before, during, and after a discrete heat event that occurs in your jurisdiction. The next slide. So actions are grouped into topical categories. These can be thought of as types of areas in which to intervene to protect health, and many are the places in which people are most exposed to extreme heat. And you can see the categories listed here on the slide. We want to note that we know there are a lot of proposed actions in this guide, and we don't expect that jurisdictions will be able to adopt every one of these actions into their plans. Some of these proposed actions or even entire categories may be out of reach at this time for many places, and we understand that. You can see this more as a menu of potential actions to consider as you go through your own planning processes. Next slide. I also want to call attention briefly to the appendices we provide alongside the plan. There are 2 appendices. So Appendix 1 is a selected bibliography of plans, guidance, and templates that we use to develop the guide. And Appendix 2 is a quick reference guide for using data and tools for your heat planning. We think this is really useful. It provides a brief description of relevant data sources and tools, and then accompanies those descriptions with some basic steps for how you can use that data resource or that tool to investigate a specific question that can help you with your local heat planning. Next slide. So you may be thinking, what are the distinct purposes of these different documents? Dan presented the 2 guidance documents, and then we have this interim guide. So we've provided an overview in this table. Broadly, there's some overlapping content, but these documents are packaged differently, and they're intended for slightly different audiences and different purposes. So the interim guide to creating a health equity centered local heat plan is a guide for jurisdictions that are undertaking like a larger heat planning process, or those that are serious about maybe selecting actions for funding and implementation. So it goes into detail on what to include and what steps to take as you're conducting a heat planning process that centers health equity. The guidance documents, the extreme heat guidance for local health jurisdictions and community service providers, and the guidance for schools on sports and strenuous outdoor activities are intended for the specific audiences listed in the document title, and they present easy to absorb, quick reference guide type information, and they compile resources, links, considerations, recommendations, action scenarios, some answers to commonly asked questions, and potential funding sources into one resource. And they do include a mention of longer term upstream solutions, but the focus is more on near-term actions. And next slide. So moving forward, the Climate Change and Health Equity branch will continue to work to integrate your feedback on the interim guide to health equity centered local heat planning and re-release the guide for this 2024 heat season. That's not the last opportunity to provide us input. We welcome your ongoing feedback as you put this guide into use. Thank you.
All right, next slide, please. And now we'll hear from Debbie Shrem. Debbie has worked in CDPH as a health educator for 20 years on asthma partnerships, addressing work-related asthma and COVID. Debbie joined the worker heat team in 2023. And yeah, go ahead, Debbie.
All right, thank you so much. My name is Debbie Shrem. It is a pleasure to be here, and I really want to thank the Climate Action Team for putting this very robust meeting together. First slide. Okay, now second slide. Great. This is who we are. I am part of the Worker Heat Program. We are in the California Department of Public Health's Occupational Health Branch. We are headed by Dr. Bob Harrison, who's a public health medical officer. I am trained as a health educator as the team lead for the program. We also have Cassie Marquez, who is a health educator, 2 epidemiologists, Stella and Allie, who's a fellow, and Joyce Vea, who is our program analyst. Next slide. Our mission is twofold. One is to establish a tracking system around occupational heat-related illness in the state. And the second is to prevent heat-related illness by addressing extreme heat among workers and providing education, resources, and interventions. Next slide. Our work really centers around being champions for workers impacted by extreme heat. We started by looking at the data and setting up meet and greets with stakeholders that are addressing heat and climate change. Now we are at the stage of developing partnerships, joining work groups addressing climate change. One of the things that we really heard loud and clear with our many stakeholder meetings was the importance of having an entity, which is us, to track occupational heat-related morbidity and mortality in California. And from that, and looking at the data, what it is that one of the projects that we're going to do is social media campaign. We're in the very early stages of it, and we are going to have an intern join us shortly to help us with the research of that piece. We are also funding some critical outreach projects to move along our work even more. Next slide. When we look at the data, it is clear that there are many industries that are impacted by extreme heat, both indoors and outdoors. And many of the industries and the people that work in those industries are low-wage workers. When we look at outdoors, we have outdoor environments include agriculture, construction, landscaping, and indoors includes places like bakeries, restaurants, laundries, and warehouses. What we're doing in our program is drilling down even further to understand how heat is impacting workers. Our program has 4 main data-related activities. One is to identify the relationship and understand it between emergency department data visits and heat-related illnesses. The second is looking at workers' compensation claims. The third is developing a database and a visualization tool with a data science team training grant. And finally, we are expanding our capacity for occupational heat-related surveillance at the local level with funding to local health jurisdictions. Next slide. So addressing climate change does represent a significant opportunity to improve public health and advance health and racial equity. When we talk about addressing extreme heat, it really is crucial to include workers in these efforts because working in hot conditions is a health equity issue. And why do I say that, and what is it that's happening? Well, when people are working in hot conditions, the body can sometimes be unable to cool itself down. And then as a result, heat can cause a variety of different short and long-term illnesses, which can range from dizziness, cramps, to heat exhaustion, heat stroke, falls, and death. And I'm a worker, but I don't work in the fields, and I don't work in hot warehouses, and I don't work in a hot restaurant. I work in my house, and when it's too hot in my home, I can go to my air-conditioned building. There are many workers who don't get that choice, and they don't get to do that piece. They have to go and be in these hot environments, and the impacts can be serious and fatal. Next slide. So I just talked about how heat can cause a variety of different short and long-term sicknesses, but I want to talk about how hot conditions can impact workers. When it's hot, workers are less productive. They fall more frequently. They're slower in their work. They make more mistakes. And I don't know about you, but when I get too hot, I get really cranky. My family, who I love, I suddenly can't stand them, and I want to have nothing to do with them. And that's just one of the ways in which heat can impact us. People also take more leave when they're exposed to heat. And the other piece that I want to point out, which has been mentioned already, is that if people already are hot during the day, it makes a big difference for them to go home to a cool environment. But if they can't cool down at night, like they have no air conditioning, for example, it can lead to potentially more heat-related illness consequences. What happens as a result is occupational heat-related illness is severely undercounted. 20,000 is an estimate. The actual reported number is much, much lower because falls, for example, due to heat, may not be attributed to heat. So really painting the big, big picture is hard to do. We're trying our best to make that happen. Next slide. And that is the end of my talk. I just want to final, my last little plug is that if in your work you're addressing climate change and heat, and if you have the option, really consider putting workers as one of your groups that is central to your efforts. We'd love to partner with you. Please reach out to us. Thank you so much.
Thank you, Debbie. Next slide, please. And next, we will hear from Vance Taylor. Vance leads the team responsible for ensuring the needs of individuals with disabilities and persons with access or functional considerations are identified and integrated into the state's emergency management systems before, during, and after disasters. Vance was diagnosed with muscular dystrophy as a child and uses a power wheelchair and is nationally recognized as a public speaker and advocate for individuals with disabilities. Vance was appointed by President Biden to serve as a member of the President's National Infrastructure Advisory Council, or NIAC. Take it away, Vance.
All right, thanks very much. I definitely appreciate it. And a lot of great information. So thanks to everybody that's been able to present today. But I do want to just touch on a few things. So I know it's been mentioned before. I think it's worth repeating and reiterating that anytime there's a disaster, and extreme heat absolutely qualifies as a disaster, there's a disproportionate impact on people with access and functional needs. And so we see that before, during, and after that event, individuals get hit the hardest. It's older adults, it's people with disabilities, it's anyone with these access or functional considerations that experience the worst of any impact. And a lot of times, that's because the systems that are designed to aid and assist are often created by extremely well-intentioned individuals, but people who lack lived experience with an access or a functional need. And so oftentimes they kind of don't know what they don't know. And unfortunately, that leads to assumptions that during events or incidents like extreme heat result in the increased suffering or loss of life among those populations. And so to get in front of this, we see California leaning forward. We see a recognition that there hasn't always been full inclusion and that we need to be more proactive on that front. And so meetings like today and these type of discussions, while difficult, are so important. I want to highlight just a few of the resources that the California Governor's Office of Emergency Services has worked with not just state agencies and local government, but with community partners and community-based organizations in order to come up with material that's helpful, not just in planning an inclusive response, but furthering preparedness and building resilience among the community. So the three resources I specifically want to highlight. First one is the Extreme Temperature Response Plan. So this supports the state emergency plan. It goes to all jurisdictions throughout the state and outlines how to mobilize and respond to extreme temperatures, not in a vacuum, but rather in coordination in what we refer to as a whole of community approach. And the aim being that when we bring the whole of the community to this effort, that we create solutions not only that are better products, but also have buy-in from the community. When we bring community-based organizations, for example, into the process, we're able to then get insights that we wouldn't otherwise have. And we increase our outreach and making sure that water gets to the end of the road, so to speak. So the extreme temperature response plan is a really key effort for helping local jurisdictions understand that when these events occur, there are certain protocols, actions, and procedures that need to happen in order to stand up an operation that's going to be inclusive of everyone's needs. The second one is the accessible cooling center guide. We know that cooling centers are fantastic resources, but it's only a fantastic resource to the whole community if in fact everyone in the community can, one, get there, and two, benefit from its services. So in order for that to happen, you have to make sure that centers are physically accessible, and you have to make sure that they're programmatically accessible. So making sure that people can show up, making sure that the volunteers and the staff who are there are trained in things like disability etiquette, and making sure that if people arrive without their support networks, that they can receive the type of assistance they're going to need in order to be safe and healthy and to maintain their independence while they're at that center. The third resource is a newly developed integrated evacuation planning guide. And this was developed in two sections. The first part is designed to empower local jurisdictions to say, hey, it's not enough to set up, let's say, a cooling center. You also have to set up agreements with accessible transportation providers to make sure that anybody who's transportation disadvantaged can get to that cooling center 24 hours a day, that they can get there not by putting in a request 24 hours in advance, but rather on demand, and that they're not going to be charged to get a ride there. That we're not going to say, well, if you want to benefit from that service, you've got to pay for it. Instead, we're going to set that up in a form and fashion to ensure that it's financially accessible for people. The other part of that guide speaks directly to people with access and functional needs. It goes into great detail about how do you plan? How do you prepare? How do you do things on your part to whatever degree you can to build your personal resilience? It's important to understand that government absolutely has a role, and that government needs to stretch. But it's also important to recognize that government can only do so much. And so we have to understand what we as individuals in the community are going to be responsible for doing, and when work with our support networks to make sure there are no gaps in our personal evacuation plans, to make sure that we're going to be safe and that we're going to be healthy, and that if we see things during extreme heat events, like power outages, like impacts at heating and cooling centers or HVAC systems, that we're not going to be harmed, injured, or become ill because of that, since we'll have a plan in place to address those needs. Ultimately, none of this happens with any one agency, any one organization, or any one partner. These plans, they were developed in coordination with the whole community for implementation by the whole community. And so it's a lift. Government will lift. Community-based organizations will lift. Then individuals in the community will lift. And together, during these extreme heat events, our safety, security, health, independence, and I would even say dignity will ascend. So thank you for letting me share those resources. I encourage you to go to the Cal OES website, specifically in the Access and Functional Needs Library, to download those. Appreciate it. Thank you so much.
Thank you, Vance, for those powerful words. Next, we will have some time for audience questions. Next slide. So to ask questions, please use the Zoom chat or Q&A features. And with that, we'll welcome back Natalie to help facilitate the Q&A portion. Go ahead, Natalie.
Yes, the question that I wanted to uplift was Lewis Bloomberg's, but I need some help seeing if it actually got answered. It was around how much is the state spending this year to combat extreme heat, and if there's a list of programs by agencies with the amount appropriated. It looks like it might have been answered, but can you correct me if I'm wrong?
Hi, Natalie. Thank you. I did answer it. I tried to make sure the answer was visible to everyone. I think actually there's a better answer, probably a more complete answer from my branch manager. And that is that about $400 million had been appropriated to address the health equity impacts in 2022, but about $12.5 million have been eliminated or proposed for elimination because of the budget shortfall. So yeah, that's more complete than what I knew. And yeah, that's about the extent of my knowledge on the exact numbers. I do not actually know what the allocation is by agency. I can find out.
That would be great, because one of the questions that on the back end we were brainstorming to ask panelists is how is the proposed budget cuts by the governor and the legislature affected, the work and the programs that's being presented here today. And for the panelists that are going to speak in the next half, maybe that's something they can also bring up in their talking points. Linda, who wrote that response, or Dan, do you want to add anything to the comments to this question?
Hi, this is Linda, and if you can hear me, yeah, I just wanted to reiterate what I put in the chat. And then Maitali said, thanks so much, Maitali, which is that of the about $400 million appropriated for the health impacts of heat in 2022, all but about $12.5 million have been cut or proposed to be cut either in last year's budget or this year's budget. And then, as you said, Natalie, thanks so much. All the other agencies do have separate amounts of funding, some of them through the Extreme Heat Action Plan, some of them through other sources. And as they speak, hopefully they can give an indication of what's happening with their budgets for heat.
Awesome, thank you. And it looks like a lot of the questions are being answered in the chat by Dan, as well as other folks that may be typing in the Q&A. So I guess I'll ask Dan, is there anything that you particularly wanted to uplift from the answers you've been typing out?
Yeah, thanks, Natalie. Yeah, I think most of these responses are pretty thorough. I just wanted to kind of circle back to the heat heat guidance for schools, again, there is additional guidance that just came out earlier this year. I actually don't know if it's quite publicly available yet, but it's for schools that are members of the California Interscholastic Federation. So under Assembly Bill 1653, there's additional requirements for guidance on schools that are part of the CIF. So a lot of high schools, interscholastic sports involved schools. And so there's more detailed guidance around using the wet bulb globe temperature, which is often considered a more accurate tool for like day of and on-site heat conditions. So the CDPH guidance is a little more of a broad guidance and can supplement this CIF guidance that again may not be publicly available quite yet, but it could be a good starting place. So just want to make those comments.
Awesome. And do we have time for 2 more questions? Yeah. Okay. One that we're reviewing in the chat didn't get answered around why not use excess death and hospitalization numbers that the state collects from hospitals? Or did you say you are using this and I missed it? I would add data for additional members of the vulnerable community, like deaths of pregnant women and their ethnicity, outdoor workers, Latinos, Blacks, and Cal-environment screen communities, etc. I think that's just for CDPH staff.
Maybe I might invite some of my teammates, maybe.
Thanks, Dan. This is Meredith Millett. I am the manager of our climate and health surveillance unit. And I wasn't sure what part of the talk that was referring to, but we do use data on heat-related illness from the hospital data that the state collects in different ways. We didn't use it for the 2022 heat wave because that data is really lagged and it takes us a lot longer to get than the mortality data. So if the question was in relation to that report, that's why it's death data and not hospitalization data, but we do have access to those data that you're referring to and use those in different ways. And also as we'll be using them more in the future as well.
Okay, and I think I'm gonna actually bring up this one that Vanessa has in the chat around, could you address measures for informing the public, particularly vulnerable populations? Because she also had a question in the Q&A about like, what about PSA for heat?
Yeah, maybe I could step in. Actually, our next speakers will be covering some of the statewide public outreach and awareness campaigns with the Heat Ready California. So that may answer some of the questions around like, public messaging and reaching heat vulnerable populations.
That makes sense, Dan. Okay, one more question then. Has CDPH looked into temperatures inside hoop houses?
This one, maybe I might invite Debbie or others at CDPH. No, that's a little bit specific, scenario.
Hi, sorry, my I lost this. There we go. Can you all hear me and see me? Excellent. We are in the process of developing some partnerships, and one of them will hopefully address hoop houses, but none of that is set in stone yet because we're looking at some contracts, but that is a piece. And then for the PSAs around heat, we are looking to, I had mentioned briefly our social media campaign, and that is absolutely around heat-related illness and occupational environments. And in terms of vulnerable populations, workers are a vulnerable population when it comes to heat stress.
Thank you, Debbie. All right, we're just gonna move on to our break now. Next slide. And yeah, so we're gonna take a quick 5-minute break just to give everyone a second. So we'll be back at 2:47. So see you guys back then. Thank you. Of partnerships. Oh. Bringing over 20 years of public service experience to the team. Prior to her role at OCPSC, Aubrey served as Senior External Affairs Officer for this COVID-19 Vaccinate All 58 campaign. Lori Hanley serves as a strategist for OCPSC's public education team, where she oversees a multi-million statewide community engagement and public awareness campaign for extreme heat. Prior to this role, she spent 15 years at Sacramento area nonprofits, where she specialized in telling the stories of underrepresented communities. Take it away, Aubrey and Lori.
Thank you so much, Kevin, and thank you to the great speakers we've just heard from. Really appreciate being part of this space today. Next slide, please. My name is Aubrey, as Kevin mentioned, Deputy Director of the Partnerships Team for the Office of Community Partnerships and Strategic Communications, also known as OCPSC. And I'm joined by my colleague, Lori Hanley, a strategist for our Public Education Team. Thanks also to the Climate Action Team for hosting this meeting, and thanks to all of our attendees today. Next slide, please. So again, just really appreciate the space today and the opportunity to share a little bit about OCPSC's listening sessions held in communities across the state of California, and as well as information on our extreme heat campaign, Heat Ready CA. First, I'll give a quick overview about our office, and then we'll talk about our listening sessions, and then hand it over to my colleague, Lori. Next slide, please. OCPSC was built on the success of Census 2020 and Vaccinate All 58 statewide initiatives, and is housed within the Governor's Office of Planning and Research. We initiate and conduct outreach and education, supporting the state's highest priority public awareness and community engagement efforts, and the office coordinates these efforts to reach all Californians, allowing the state to realize more inclusive and effective outcomes while preventing equity gaps and distrust of information in state government outreach. Next slide, please. We're fortunate as an office to be able to do a lot of listening and learning in our work, and we do this through an ecosystem of trusted messengers, meeting people where they are and in their communities. A large part of this is to inform what we as an office are doing and ensure that our work reflects the challenges and strengths of the communities we serve across the state. Through the listening sessions, we learned how participants from 10 different identified vulnerable groups think, feel, and behave when confronted with events or situations related to extreme heat and COVID-19. These listening sessions were used to develop effective messaging and outreach resources to support our extreme heat campaign. Next slide, please. So between March and June of 2023, OCPSC organized, launched, and completed 10 unique in-person conversations with over 100 participants. The selection of demographic and sociographic groups represented in the 10 listening sessions was intended to closely mirror traditionally underserved, vulnerable populations deemed to be at risk during the COVID-19 pandemic and or extreme heat events. Today, we'll be focused on sharing our learning on extreme heat specifically, much of which has been touched on already by our previous speakers. Next slide. So the who and the where, with guidance from our amazing partners at CDPH, the 10 identified groups we held listening sessions with were older adults, housing insecure, low-income urban residents, older adults with chronic health conditions, low-income rural residents, people with limited English proficiency, families with children 0 to 5, farm workers, Indigenous community members, and people with disabilities. Next slide, please. So here we'll talk about the most frequent themes heard by each identified community during these listening sessions. There are concerns about health and safety surrounding housing, economic security, and legal status, Many participants reported a lack of access to safe and available drinking water during extreme heat events, and communities expressed concerns about access to affordable, safe, and engaging locations for cooling centers that work for the whole family. As an example, as you'll see here in our families with children 0 to 5, listening session, access to safe, available drinking water has been problematic since the COVID-19 pandemic. And in our group of our listening session group with people with disabilities, electricity and power supply are very important to people with disabilities during extreme heat, as many are dependent on medical devices and air conditioning to stay well and or alive. Next slide, please. The most frequent themes we heard among the groups listed here was lack of transportation being a major issue amongst community members to be able to access cooling centers. And many Californians face severe financial sacrifices when deciding between running the air conditioning versus other basic needs for themselves and their families, like paying rent or putting food on the table. An example of this is what we heard in our low-income rural resident listening session. Access to resources is difficult and becomes problematic with undependable cell phone signals or lack of a home address. Next slide, please. Here we'll move into some overall emerging themes. These overall emerging themes were guided by questions asked by the facilitators at each listening session. They were divided into 6 topics and uncovered multiple subtopics amongst the learnings. First topic was the perceptions of heat risks and challenges, which included mental health and isolation. We heard that extreme heat leads older adults to close their homes and stay indoors, which in turn leads to mental health decline and vitamin D deficiency. Physical health issues, where we heard that physical reactions to heat vary greatly amongst individuals and throughout an individual's lifespan. For example, a young child may not know when they are overheated and won't know to drink more water. And older adults may have underlying medical issues such as a heart condition, making the impacts of extreme heat even worse. Also, the knowledge and benefits about extreme heat. Farm workers and outdoor workers reported that they recognize that they face serious health risks and they do know how to keep themselves safe from extreme heat, including the importance of hydration and protection from the sun. However, they struggle to balance their personal safety with the financial pressures they face for themselves and their households. Next slide, please. The next topic was strategies and challenges associated with managing extreme heat. Participants here discussed personal coping strategies, including using fans, staying hydrated, seeking shade, and wearing cooling vests. They also highlighted reliable electrical sources are important to charge medical devices. And then the next topic of information sources used by individuals to cope with extreme heat. We learned that many people rely on word of mouth and social media to get information out about, or to get their information about extreme heat events. And some of the challenges of access and affordability. Access to clean and reliable sources of water is a main concern for many people that struggle to hydrate during extreme heat events. Next slide, please. The next topics covered access to and utilization of power and water. Concerns about power outages. Many expressed concerns about accessing electricity, especially for family members who rely heavily on electronic devices. Restrictions and challenges regarding air conditioner use. Keeping people's homes often come with a steep cost. Also cost associated with running air conditioners for those who had transportation and vehicles. Access to cool water, also another topic where many participants reported struggling to remain hydrated due to limited access to clean and cool water. Again, water bubbling up to be one of those issues that we heard. Next slide, please. Here, the participants discussed the accessibility and utilization of cooling facilities and viewed cooling centers as beneficial. The use of public spaces like libraries and malls as cooling centers is a common strategy, but sometimes the availability and accessibility of such spaces was voiced to be a concern. Next slide, please. Here, the participants discussed topics of the implications of housing and living conditions on heat management. One of the topics there was perceived relationships between housing and heat management, where many participants living in older, poorly insulated houses or apartments were not well insulated or didn't have adequate cooling systems. And without proper insulation, these homes can become unbearable during extreme heat events, making it very dangerous. Next topic was perceived challenges for renters and multifamily housing residents. Many reported that rental units are not properly insulated again, and many property managers do not permit window units. Next slide, please. Finally, participants discussed public policy, communication, and awareness topics. Here, perceptions of public policy and governmental responses to extreme heat. Participants expressed the need for more government support in managing heat, including better access to air conditioning and cooling centers, more education and public awareness programs about the dangers of heat, and more policies to support those who are most vulnerable. And lastly, the need for greater public awareness and outreach. Participants expressed the need for better communication and planning at the community level. Next slide, please. So taking all of this, our office is really, as I mentioned, community informed and creating learning to action. So we're, really pleased that we were able to incorporate these learnings in many different avenues of our work, connecting community to outside resources. Many participants expressed that extreme heat events take a mental health toll on folks. And so we worked with our public education team and our partner, the National Alliance on Mental Illness, otherwise known as NAMI California, to create easily accessible mental health information and resources, shared learnings with other agencies. So being in spaces like this where we can really share the information further and wider is a great privilege for us, and adapting messaging shaped by the feedback that we received. So adapting messaging by creating more imagery, less text, less dense text, and larger fonts and simplified language for more accessible information to our community members. So with that wraps up my portion of the listening sessions. I'm really pleased to hand it over to my colleague, Lori Hanley now, who will share a little bit about our Heat Ready CA campaign.
Great, thank you. Next slide. So basically our Heat Ready campaign launched last year in July and ran through October, and is really born out of the extreme heat action plan that the administration released in 2022. Really, it is meant to be a statewide campaign that educates Californians about the dangers of extreme heat and preparing them for extreme heat events. So if we go to the next slide. This year is year 2, and we have launched the campaign in May. It will run through October. We do have a network of 142 trusted messengers that really go out into the community and reach those who are most at risk for heat illness. We also partner with state agencies, many of whom are on the call right now, statewide nonprofits and faith-based organizations to amplify the messaging that we put out, and also all the messaging that they put out. We have a commitment to utilizing ethnic media outlets to make sure that we do reach the most vulnerable. And we are launching a research survey probably in June, and we'll do another one in October just to measure our impact and perceptions around heat. And then website updates and new toolkits will be coming soon, hopefully in June. And to address the question that was in the chat, we do have basically $14 million over the next 2 years to educate Californians, and we'll be utilizing not only ethnic media, but all kinds of assets, including social media, billboards, radio, print, video, etc. And they're all available to use on our website as well, and they will be updated shortly. So with that, I'll turn it over to Kevin. Thank you.
Thank you, Aubrey and Lori. Go ahead, next slide. And next we will hear from David Hornung. David started work for Cal OSHA in 2009 as a compliance officer in Oakland. He spent his first summers with Cal OSHA performing heat inspections in the early days of the Heat Illness Prevention Standard. He is currently the statewide heat program coordinator with Cal OSHA. Go ahead, David.
Thank you, Kevin. Really nice to be invited here today. This feels like the all-star of heat illness prevention. It's nice to hear from Dan talking about heat risk map, which I'm going to cover a little bit. Debbie and their team have worked with us, and we're going to review some of their data before. I'm going to mention that. And then Vance, who I seem to spend many summer days on calls with him when Cal OAS gets activated. So it's nice to see everyone here. Nice to be invited back. I was here 2 years ago to talk about heat and wildfire smoke during COVID, and I hope to share some updates on what we've done in the last couple of years. So I have 12 minutes today. I need to start my own timer here. Otherwise, Kevin's going to give me the hook. I'm going to cover Cal OSHA's regulations on heat illness prevention for outdoor places of employment, and also discuss our proposed regulation on heat illness prevention for indoor places of employment. I've been really excited to talk about an indoor heat regulation for a while now, and it's not yet law, but it's very close. 2 weeks ago, Cal OSHA issued the fourth and hopefully final 15-day notice of proposed modifications as part of the rulemaking process. That comment period closes tomorrow, so it's still open for anyone interested, and there should be a vote on this revised regulation next month. I'm also going to cover some of the outreach and enforcement that we've done related to heat illness prevention and wildfire smoke protections. Now, I feel like this has been covered by everybody. When you talk about heat, you got to give some data that heat is very deadly. So I recognize I'm preaching to the choir a little bit, but I borrowed this data from the National Weather Service. Recently, they held a call discussing their heat risk map, and they highlighted the hazard of heat. It's the leading climate-related killer, and climate change is causing our heat waves to be hotter, longer, more frequent, with less overnight relief. That is, it's not cooling off as much at night, and that's increasing these heat illnesses. In California, the best estimates that I've seen, thanks to actually Amy Heinzerling and CDPH, show that about 1,000 workers a year are going into the hospital and getting diagnosed with heat-related illnesses, and that comes from the workers' comp data. In California, we have about 4 million workers that work outdoors. It's like 20% or so of our population. And then for indoor work, we have about 1.4 million workers that are in hot workplaces that are expected to be impacted by this proposed standard. So that's roughly, I compared it to states. You always compare to Rhode Island, but today it's the same number of workers in the entire state of Hawaii or New Hampshire or Maine. The regulation is going to affect a lot of workers. It's estimated to affect about 1 in 8 workplaces in California. And when employers implement the requirements of this proposed standard, not only are they going to make it a much safer workplace for these 1.4 million workers, I think, quite frankly, they're going to make the workplaces a lot better places to work. And I think Debbie was mentioning this point. I'm in my home, it's air conditioned, but many workers don't have that feature. So it's difficult to work in hot environments, and hopefully this will cool those hot environments. So what's in the standard, the proposed standard? Generally, and I'm skipping over some of the fine detail here, but generally the regulation is going to apply when indoor temperatures are above 82 degrees. And for a variety of, I think, pretty good reasons, the proposed indoor heat regulation is designed to be very similar to the outdoor standard. Both of them have requirements for provision of water and places to cool down. Both have emergency response procedures, acclimatization procedures for new workers, training requirements for employees and supervisors, and the requirement to have a written program. The biggest difference between these two regulations is in the subsection E. So rather than high heat procedures, the indoor heat regulation requires employers to assess the indoor temperature, and again, generally, if it's above 87 degrees, to cool the workplace and implement other controls. So to me, the subsection E is the most important part of the regulation and will change workplaces the most, requiring feasible engineering controls to lower the indoor temperatures. So I want to give you the definition of it, what an engineering control is. It's a control device that removes or reduces hazardous conditions or creates a barrier between the employee and the hazard. The definition is in our proposed regulation, and it also includes a long list of examples of different engineering controls. So there's a lot of potential solutions here for employers, such as the straight ahead air conditioner, or better yet, heat pumps. So for many hot indoor environments, the regulation is going to require that employers implement feasible engineering controls to reduce the indoor temperatures. And in the coming years, we're going to talk a lot about what feasibility means. And our time today is really limited, so I'm just going to touch on it really briefly. But feasibility is not defined in our regulation. I'm going to mention two types of feasibility. The first is technical feasibility. That's whether there's a technical solution. It involves evaluating whether there's the necessary technology, resources, expertise, infrastructure available, or can be developed within a reasonable time frame to cool the environment. So some technologies like air conditioning are already there, but in some cases, air conditioning won't be enough to cool down a place. Then there's economic feasibility. What are the costs of these different control measures, and are they financially viable for the company? As you might expect, the feasibility issue will vary across different work environments. And I think in the coming year, I'm really excited to see some clever solutions by employers that they'll use to make their workplaces cooler. Now I'm going to shift and talk a little more broadly about the various outreach and enforcement efforts centered on heat illness prevention. Shortly after 2005, when this regulation was first created, Cal/OSHA established a special emphasis program, or SEP, to address outdoor heat hazards. Our SEP details our comprehensive approach to preventing heat illness and death of workers. The approach includes strong enforcement, extensive outreach and education, and multimedia coverage. Our heat SEP also describes how we go beyond the requirements from our labor code to address the hazards of heat exposure to employees. One of the ways we do this is we open all reports of heat-related illnesses, and we open all complaints for outdoor heat-related complaints. As part of our heat SEP, during every inspection of an employer with outdoor workers, our inspectors must evaluate the employer's heat illness prevention plan. Last year, we did this in over 3,000 inspections. And of these employers, we issued citations of the heat illness prevention regulation in about a third of the cases. The majority of these citations are for problems with the employer's written plan. We also investigated about 110 suspect heat-related illnesses or fatalities. And of these 110 cases, we review the medical records for the cases, and about 45 of these cases were deemed heat-related illnesses, and there was also one heat-related fatality. In addition to the work we do responding to heat-related complaints and illnesses, we also perform 250 proactive high heat inspections. These are inspections where our field staff on the hottest days of the summer drive around their local jurisdiction looking for workers to make sure those workers have some of the very basic protections like water and shade and bathrooms. And where we find non-compliance, we often get immediate correction of those problems right away. Also in last year, recognizing the need to serve various agricultural communities across the state, we've opened new district offices in 3 locations: Fresno, Santa Barbara, and Riverside. As I just mentioned, the most cited violation of our heat illness prevention regulation continues to be for failing to have a written program or failure to implement what's written in the employer's program. Other top violations include not providing effective training to all staff, not providing water that's fresh, pure, and suitably cool, or not providing shade that's close enough to workers. Now I'd like to shift and talk about what we're doing to educate the workforce about their rights and our regulations. We're continuing to try to innovate and meet the workers where they're at. 2 recent efforts include our labor rights caravan and expansion of our bilingual community engagement unit. In 2020, the Department of Industrial Relations launched an innovative model for bringing state agencies to partner with community-based organizations to bring important information directly to workers in their communities. The Labor Rights Caravan is a model that helped to build relationships with local, state, and federal agencies to bridge the gap between communities and governments by working directly with trusted messengers in communities across the state. And we just heard a very similar message from Lori and team. In the last year, we've also expanded our bilingual community engagement unit from 2 staff up to 6 right now, and hopefully it'll be 7 next month. These are geographically spread out across the state, including a worker, which we're excited about, in Imperial Valley, which has been hard to serve. Our bilingual team members speak both English and Spanish and play a crucial role in organizing and collaborating in outreach and education events, such as worker rights caravans, trade union conferences, in-person presentations at Mexican consulates in California, and workers' clinics. If anyone here is interested in collaborating with your local bilingual community engagement liaison, please reach out to me. During the pandemic, we also recognized the need for workers to be able to call us and get safety information. So we have our new Cal OSHA call center. It's staffed between 9 to 7 Monday through Friday with all former DOSH managers and senior staff, really knowledgeable staff that are able to provide answers to questions about COVID-19 or heat illness prevention, and also help workers file complaints. So we're about 11 minutes now. I've talked about our regulation, our enforcement of the regulation, some of our outreach efforts. In the last few minutes, 1 minute, I want to share ways we're trying to get the word out about the regulation and help in the protections it provides. Each year, at the beginning of the year, we hold this Heat Illness Prevention Network call. We held it in April. We had about 200 attendees, a mix of CBOs and employers and workers. That video is on our website. You can check it out. And if anybody here would like to join that mailing list, you can email us at hipnetwork@dir.ca.gov. We also have a media campaign that's targeting Spanish and non-English speaking workers, and some of those outdoors. We have a budget of close to $900,000, with about 2/3 focusing on heat illness prevention and the other third on wildfire smoke. We've been running this campaign for about 10 years, and traditionally we've spent about half the money on radio. This year we're shifting it a little more to this out of home, which are these images you see here. And we're also trying out digital ads this year, where they'll only be advertised when the temperatures are over 90 degrees. We also expanded our campaign 2 years ago to include wildfire smoke in indoor workplaces. And here are some of the ads for that. This year is going to be interesting. It's our media team noted that it's a political year with the campaigns going, so media inventory is more limited and more costly. But I hope that some of these adjustments we've made will get our messages to workers. I think we're going to send these slides out to everybody later. So here you have our number. If you interact with any workers that have health and safety questions, would like to file a complaint, please share this number here. And then finally, here's a list of a variety of resources I won't have a chance to go through today, but I encourage you to check these out later. Thank you very much.
Awesome. Thank you so much, David. We'll go ahead and move the screen down. If we can jump over to Braden's intro slide. Let's see. And almost there. There we go. Thank you so much. Yeah, so next we'll hear from Braden Kay. Braden is the Extreme Heat and Community Resilience Program Manager in the Governor's Office of Planning and Research. He is the former Sustainability and Resilience Director of the City of Tempe, Arizona, and he holds a PhD in Sustainability from the Arizona State University. Take it away, Braden.
Thank you, Kevin, and thanks so much for having me here today. We can go ahead and skip the title slide and go to the next slide. So as you've heard, I've recently come from Arizona, and I'm really proud to join the Governor's Office of Planning and Research in the state of California. That really truly has, in my mind, the most impressive all of government approach to extreme heat. of any state in the country. And that includes the statewide heat action plan, the first one of which we had in 2013, the update that was in 2022, and now we're going to be doing it every 3 years, starting in 2026 with the next update. There's the Heat Ready California work that you've heard. So many of the programs you've heard, you're about to hear about the heat warning system from Walker and Cal EPA. And then there's also the emergence of our new extreme heat and community resilience grant program, as well as so many of the approaches you've heard today, including from Department of Insurance, from the California Department of Public Health, Cal OSHA, and other state agencies. And the first thing you have to ask yourself is, well, why is this all of government approach needed? And I think, you've heard a lot today. You heard from the last presentation, the indoor heat, or the outdoor heat standard is named after Maria here, who was working in a grape farm east of Stockton and died from complications of heat exposure. And we have examples of Californians all across the state who have died from extreme heat. Joshua Robinson in Lake Elsinore collapsed after a PE class, according to his parents. Esteban Chavez died the day after his 24th birthday as an outdoor delivery driver in sweltering heat in Pasadena. And then the Heat Will Kill You First book also highlights John Garish and Ellen Chung, who were hikers who passed away in Mariposa County after having moved there from the Bay Area. And so if you search the internet, you can find examples of Californians that have passed away from extreme heat. These are 6 Californians that are an example. Harder to find on the internet are the images of our aging older people in California that pass away, people living in mobile homes, many people experiencing homelessness that have passed away from extreme heat. And so both heat-related illnesses, the changing lifestyles, as well as these just devastating heat deaths, every one of which is preventable, is why all of government approach is so necessary. Next slide. So we do have this statewide heat action plan. It has 4 tracks, many of which have come up in today's conversation. Building public awareness and notification of 99 Calor and Heat Ready California are great examples of that. Strengthening community services and response, the work that you'll hear from Cal OES is a great example of that work. Building resilience to extreme heat in our built environment, so changes that can be made. And you've heard CDPH in their guidebook for heat planning mention some of the important built environment solutions: cool roofs, building retrofits, cool pavement technologies, different types of air conditioning technologies that are really important for us to be investing in. And then there's the role of nature-based solutions, so community greening and gardening projects, urban forestry, green belts, lots of opportunities to try to cool our communities throughout the state through nature-based solutions. So if you haven't seen it yet, we'll make sure to drop a link in the chat to the heat action plan. It really outlines how state agencies are supporting this work as you're thinking about potentially doing heat planning in your own jurisdictions. The statewide plan is a tremendous resource to pull ideas from and to consider ways to make sure that you're utilizing state resources as you're developing your local plans. We also have out of this action plan came this proposal for funding an extreme heat and community resilience grant program. Next slide. So that is integrated into the Office of Planning and Research's ICARP program. It's our Integrated Climate Adaptation and Resilience Program. There's actually 3 different grant programs as part of this family of grant programs. One focuses on climate adaptation planning, one on regional resilience, and then this new extreme heat program is the 3rd in that family. Next slide. So the program's vision is really to join the existing efforts that are happening across the state to tackle both immediate heat relief, saving lives this summer, as well, and in the coming summers, as well as building this longer term resilience to extreme heat. And trying to support the statewide movement through placemaking and placekeeping, through immediate response and long-term resilience, and looking to the opportunity for technology deployment and job creation, all while centering the health of Californians who are most vulnerable to extreme heat. And you've heard that message over and over again today. Next slide. So as we've been developing the program, we also did a listening tour and worked very closely with the Office of Community Partnerships and Strategic Communications that also did a listening tour. And in the listening that we've been doing, we've been hearing a lot about some of the key values. I love that it was brought up the need for really a strong attention to inclusion and language justice and meeting the needs of access and functional needs communities. We've been hearing that as something that's needed both in state programming as well as local programming. We've also heard a lot about this idea that there's already a lot of harm that's been happened because of climate change and extreme heat, and that as we do this work locally, there's an opportunity for harm reduction and healing, for hiring the healing arts professionals, social workers, and others that can really help communities not just plan for the future and become more resilient, but also help with healing. So next slide. So we have developed this grant program. It has various sizes to meet the different needs of Californians. Next slide. It's along the lines of these 4 action grants. And so we have the public awareness. These are some of the ideas that people are thinking about when they're building their grant proposals. Next slide. One example of this is from Arizona, is of Jenny's Trailer, which is a trailer used to bring cooling resources to people. Next slide. Then the other tracks, increased resilience to built environment and nature-based solutions, and some of the ideas there. Next slide. This is a really cool example from Massachusetts where they've actually used all 4 of the tracks to focus cooling efforts block by block. So they're investing in different blocks. They call it the Cool Blocks program. And we can drop a link in the chat. It's a very cool example of how you can combine awareness, response, nature-based solutions, and built environment, cool pavement solutions all into one project. Next slide. So just a few thoughts moving forward, as you've heard today, as you consider your extreme heat work locally, as we all work together as a state, there's an opportunity to embrace inclusion. There's an opportunity to continue to work on holistic community resilience. There's an opportunity to do workforce development and really create jobs out of the extreme heat challenges that we have. And there's also opportunities to figure out how we use some of the state funding that exists to create permanently funded landscape transformation that is helping with that long-term resilience that we need to see in communities across California. So happy to answer questions later, and thanks so much for your time.
Thank you. Next slide, please. All right, our last speaker. Next, we'll hear from Walker Weiland. Walker is the program manager of the Extreme Heat Ranking System Development section within the Office of Environmental Health Hazard Assessment under the Cal EPA. Take it away, Walker.
All right, thank you, Kevin. And I'm going to go ahead and share my screen. Great, so you should be able to see my presentation. So many good talks today. I think I'm the last presenter. I appreciate everyone who's staying on to the last one. Just a teeny bit more about me. Before I started working in this space at the beginning of the year, I spent the past decade plus developing Cal EnviroScreen, which is a tool I'm sure many of you are familiar with, mapping vulnerabilities across the state. And in some ways, that's what we're doing here in relation to extreme heat here at Cal EPA. And so, why are we doing this work? It comes as a result of Assembly Bill 2238. This bill required our agency to develop this extreme heat ranking system for the state, not only based on weather data and people's health response to heat, but it really charged us with putting together these measures of extreme heat severity and how people respond to extreme heat. Also asks us to incorporate locally relevant information, right? So much more of a local effect, thinking about urban heat island effect, thinking about locations of cooling centers. This is another process similar to Cal EnviroScreen that's really going to be driven by public input and something that we're really focused on. Of course, we're not doing this work ourselves. We're working in collaboration with some of the state agencies that you see on your screen. So what will Cal Heat Score do? Just to be clear, we're very early in our process. We won't launch the tool until the end of this year. But here's some of the things that we're thinking, right? It's going to be a tool that maps risks to extreme heat online, providing forecasts very similar to weather apps, but also connecting people to relevant resources related to extreme heat, cooling centers, libraries, local pools, local information on emergency-based responses. And so it's going to put together these thresholds or these rankings of extreme heat that not only look at variations in climate change, but the multiple measures of heat, maximum temperature, wet bulb globe temperature, duration of extreme heat, seasonality, right? A lot of different things with the focus and looking at, where are the people that are most vulnerable to extreme heat throughout the state, really a location-based strategy, and factoring in the different kinds of health responses that people have to extreme heat. So this is both heat-related illness and heat-related mortality. And so how are we going to get there? Well, we're going to use high-quality information, the best available science that's out there, and lay out a transparent process for how we build this tool and how we're sort of committed to iteratively improving on the tool. So this first version that you'll see at the end of the year is really just version 1, and it's a tool that we're going to be improving on over time. It'll be a tool that'll be translated in multiple languages. It will be formatted in a way so that it's easy to understand and interpret risk to extreme heat. And there will be a particular focus in this tool on not only partnering with our partners at CDPH on health protective actions that you can take based on the environment that you're in, but also really providing these resources to low-income communities, communities of color, often those that are the most disproportionately impacted by the effects of extreme heat. So I'm going to skip over this in the interest of time. I know we're short on it, but we're going to have more details at our meeting tomorrow that I'm going to plug on how we're thinking about going about this, but really want to get more information and more input from our audience on what we're going through. We're also building a website, right? Like a dashboard, a map-based dashboard that you can see and you can interact with, that will be a mobile device-friendly dashboard where you can not only get a forecast of what heat rankings look like, identify the nearest cooling center and get directions to it, but also pull up information about number of elderly, percentage of outdoor workers, and information about vulnerable populations in the community. So that's some of the vision we have for our website. Just to be clear, what you're seeing on your screen is not the Cal Heat Score dashboard. This is just an example of what it could look like in the future. So our roadmap, where are we going from here? Well, tomorrow we have a kickoff meeting that I'm going to link the Zoom registration and the information about in the chat. Later on this year, we're going to have another hybrid meeting to share our progress on Cal Heat Score. End of the year, launching Cal Heat Score, the first version, and then take more comment on what we can do to improve it. And then once we get into early next year and towards the heat season for next year, really more of a focused user testing and workshop approach for our tool. So I know I moved through that really fast, want to be respectful of everyone's time here. I'm going to link our website and our program email in the chat. We've got a kickoff meeting tomorrow at the Cal EPA building in Sacramento, but also on Zoom. I please encourage you to, if you're interested, to register and attend this meeting tomorrow at 10 a.m. To learn more about Cal Heat Score. And so I'll stop there. Thank you so much.
Thank you, Walker. And yeah, Dan did link off to all the Zoom registration meetings for you. So that's already done. And with that, our meeting comes to a close. A quick reminder to all attendees that the meeting recording will be online in about a week, and you can access the recording on the Climate Action Team Public Health Workgroup meetings page via the link shown here, and we'll also put that in the chat for you. And if you have any questions or want follow up with anything discussed today, please don't hesitate to contact us at climatechange@cdph.ca.gov. And I want to express our sincere thanks to all of today's expert speakers, our facilitators, and staff who helped pull all this together. And a great thanks to all of you for joining us today. Take care, stay cool this summer, and have a great rest of your day. Thanks, everyone.